In this video, we are going to talk about rheumatic fever. Rheumatic fever is a multisystem autoimmune inflammatory disease caused by Group A Streptococcus bacteria. It can develop when throat infections such as pharyngitis, tonsillitis, or scarlet fever are not properly treated. It is most often seen in children aged 5 to 15 years, although it can also occur in younger children and adults. Pathophysiology. When the throat becomes infected by Group A Streptococcus, the body's immune system produces antibodies and T cells against the bacterial antigens. However, the M protein of the Streptococcus bacteria is also found in the synovium, heart muscle, skin, and central nervous system. Because of this, antibodies directed against the bacterial M protein cross-react with the M protein in the body's own tissues, producing an autoimmune response. This phenomenon is called molecular mimicry. As a result, this antigen-antibody cross-reaction causes inflammation and tissue damage, mainly affecting the joints, heart, skin, and central nervous system. In the joints, it causes migratory polyarthritis, which typically affects the large joints such as the ankles, knees, and shoulders. The involvement is usually asymmetrical and migrates upwards. The joints become painful, swollen, and tender, but the pain usually subsides within about 2 weeks. In the heart, all layers may be affected together or separately, leading to carditis and sometimes heart failure. In the skin, subcutaneous nodules may develop, which are collections of collagen found mainly on the extensor surfaces of the hands, elbows, and knees. There may also be erythema marginatum, a non-itchy rash with pink margins. When the central nervous system is affected, Sydenham's chorea may occur, which presents as involuntary, jerky, purposeless movements, most commonly affecting the face and hands. Signs and symptoms. Because it takes time for antibodies to develop, signs and symptoms usually appear 2 to 4 weeks after the initial throat infection. Common symptoms include fever, joint pain, subcutaneous nodules, erythema marginatum, Sydenham's chorea, and carditis. The carditis can cause chest pain, dyspnea, and palpitations. Repeated gas attacks may damage the heart valves, leading to cardiac murmurs as well. Rheumatic fever is diagnosed based on the modified Jones criteria, along with evidence of a preceding Group A streptococcal infection. The Jones criteria can be remembered with the mnemonic Jones-Cafe-Pal. The major criteria include joint involvement, arthritis, carditis, subcutaneous nodules, erythema marginatum, and Sydenham's chorea. The minor criteria include increased C-reactive protein, arthralgia, fever, elevated ESR, prolonged PR interval, anamnesis of rheumatism which mean history of previous rheumatic fever, and leukocytosis. The diagnosis is made if there is evidence of a preceding streptococcal infection with either 2 major criteria or 1 major and 2 minor criteria. If a person has Sydenham's chorea without other findings, but other causes of movement disorders are ruled out, it also supports the diagnosis of rheumatic fever. Treatments. The goals of treatment are to relieve symptoms, eradicate infection, and prevent recurrence. For pain and inflammation, NSAIDs are commonly used. To eradicate and prevent recurrent infection, penicillin is given every 3 weeks as prophylaxis. If the patient is allergic to penicillin, erythromycin can be used instead.